Greetings, my name is Tyree Clyburn. This was a presentation created by Mirendra, Scott, Ralph Williams, and myself. It will be a presentation on MUSC patient experience improvement and employee satisfaction.
The Medical University of South Carolina's leadership team got together to make some adjustments to their protocol and policies and procedures that were designed to keep all staff, students, residents, and visitors safe while preparing for the effects of COVID-19. The changes made to their travel policy focus specifically on international travel, domestic travel, and MUSC travelers that plan on returning to campus. They made sure that those who were traveling back knew that if they were experiencing any kind of fever, cough, or having difficulty breathing, they had to notify their supervisor, leave work, stay home, and find their way to MUSC virtual care site where they would be able to receive the information that they needed while they were out of work. When Governor Henry McMaster held a statewide press conference, he announced that all schools would be closed until March 31st. He recommended that educational institutions were authorized to make any necessary and appropriate decisions or arrangements to account for local needs and other unique circumstances, which included the suggestion of virtual learning. The institution noted that they would be following the CDC guidelines that had specific rules and regulations for gatherings, events, and meetings that suggested that they cancel or postpone all in-person events with more than 50 people. On May 7, 2020, the Medical University of South Carolina gave an update on how things would go after transitioning back to normal. They created a criteria and approval process for researchers who were not able to continue their research remotely. They noted that the university would be providing disposable masks and the leaders would be responsible for instructing their teams on how to collect and dispose of masks. All staff that remained working on campus had to consistently self-monitor for the COVID-19 symptoms, which included runny nose, sore throat, cough, shortness of breath, chills, muscle aches, and headaches. In July of 2020, the university adopted stricter mask mandates as well as other things that made the campus operate. All staff and students were to wear masks while in all buildings that were open to the public that included classrooms and conference rooms. They also held trainings on how the mask should be donned and doffed. Those instructions included cleaning hands with an alcohol-based hand sanitizer or washing their hands with soap and water for at least 20 seconds. This institution also held trainings on the usage of gloves. The medical university also put procedures in place for how to social distance traveling through the different floors. All employees and students had personal responsibilities to adjust to as COVID-19 cases in the area remained consistent. With all of the trainings held for the adjusting to the pandemic, MUSC has similarly acquired good news. It was reported in the university's Catalyst News that the infection growth rate had gone down from 3% to 1.8%. The overall number of hospitalizations were decreasing, and all three of the large hospitals in the Tri-County area had manageable numbers of COVID-19 patients. This shows that the policies and procedures and protocol that they put in place initially has been effective for their community.
Our next section will focus on employee satisfaction and training. The employee turnover rate in the healthcare industry is a significant way to understand and test the individuals that are in leadership roles in the healthcare industry. It allows these leaders in the healthcare industry to make these decisions based on what they've collected from the data and make improvements within the organization based on that data. It is important that they focus on employee satisfaction and training in order to improve the quality of service that they provide to their patients and also become a more profitable business. If you have a happy employee, you equal out to a happy patient. It's all about improving the employee, benefiting them, providing ways for them to grow and improve themselves. And as long as they're happy and satisfied with their job, then they will also provide that same quality of service to patients, and the patients will also have that quality of service and be happy as well. Enhancing the employee experience will result in higher patient fulfillment, improved productivity, reduced turnover, and become a more prominent main concern in the healthcare industry. More patients will be serviced. Employees will be more productive, putting 100% towards whatever they do in the workplace. There will be reduced turnover, meaning that employees will want to stay and work longer for the company because they are satisfied and they feel that they can build and grow their career. And leaders also making a more prominent main concern to themselves as far as making sure the employee is satisfied and tended to making sure that they have the best employees and that they can do anything for them that'll make their job easier. Leaders in the healthcare industry must remember to prioritize this and make sure they create new opportunities for employees as well. So the 5 recommended ways to improve the healthcare industry included the following: creating a development plan for employees, prioritization of employee training and development, aligning the employee with organizational goals, analyzing and collecting employee feedback, and providing employees with an enjoyable work environment. Creating a development plan for employees. At times, employees don't feel secure about their career path. They don't feel secure about where they're headed next. And it's up to these leaders and executives in the healthcare industry to build plans for their practice so that they basically ensure that the employee is equipped with all the skills that they need for the position that they work. If the employee feel that their career is set in stone, they have a plan, they have goals that they can work towards, then they will want to stay with that company, and that will overall result in happy employee, meaning happy patients. Their commitment will affect the company positively and show that they will benefit from working with that company, and they are of value to that company as well. When it comes to creating the development plan for the employees, leaders and executives must understand how engaged employees adds to the success of the company. Once they understand this, they'll be able to come up with a plan and develop plans that help benefit the large goals of the company itself. Leaders must organize this plan in a way that it best serves the employees' needs and the business needs so that the overall result is better patient quality service. Leaders use these goals and this plan to help keep employees on track, and it'll overall improve their productivity in the workplace and satisfaction with their positions, overall creating happy employee and a happy patient. Employees that can easily access valuable training and development opportunities are typically more engaged. Research has discovered that reliable development opportunities can reduce employee turnover and produce up to double the income, meaning that reduction in employee turnover means that employees are satisfied and they want to stay with the company, and as well as they'll be more satisfied because they're receiving up to double the income that they were receiving beforehand. There are many reasons why the healthcare organization should put resources into the development of their team. It's just important to invest in your team because it can reduce costs as far as hiring new individuals to come and work for the company, which could be costly, and it allowed them to remain cost efficient. Investing in employees is very, very significant for leaders in the healthcare industry. Millennials, especially, are students that need some they're students that need some hope for their career path. They look for something to build towards, something to grow towards. So if they lack this feeling from the company itself, they won't be more entitled to stay with the company. They'll find more opportunities to build, and that means finding other companies as well. So that'll kind of hurt the company in a sense, but it's up to these leaders to make sure they're engaged and that they're developing these employees and providing career paths for them to grow to. This is an example of a company investing resources into their employees. One orthopedic practice launched a new website instead of just sending out an internal email to their employees saying, "Hey, go check out our new website." The practice decided to engage and involve their employees in the process. Practice managers organized a website scavenger hunt where employees had to hunt down unique information on the new site and provide their feedback and impressions to win prizes. Not only did the activity get all 3 practice locations energized and excited, it educated employees about the practice and also gave the website a free trial run for link integrity and page layout. This is a perfect example of a company investing resources into their employees. Not only did the company stray away from the typical check out our website, they also engage their employees and allow them to have input in what the company is doing. So that allowed them to make a decision and feel valued to the company. Aligning the employee with the goals of the organization is extremely important in the healthcare industry. Most employees that enter the healthcare industry have a solid passion for helping other people. The healthcare industry leaders and executives must make a priority to communicate the goal clearly to employees of what their objectives are for the company. Healthcare leaders and executives must set their employees up for success by giving them basic tools to be successful and grow their career with the company. And when you associate this employee's passion for their work, it reinforces their dedication to the company and improves their productivity with the company as well. Analyzing and collecting employee feedback is one of the most important things when it comes to improving patient care and making sure employees are satisfied and that they're being developed. Data that's collected from employees, that is feedback, must be thoroughly analyzed, and executives and leaders must analyze the information and be able to put plans together that benefit employees as well as the organization based off of this information. And there are two significant components to consider when using this employee feedback the right way. The first one is sharing that feedback that was collected with the employees. It is extremely important to share that feedback with employees because it builds honesty and trust within the company, and that's between executives and leaders and employees itself. If employees are giving feedback and they don't feel like leaders are paying attention to it, then they won't feel valuable to that company. Healthcare leaders and executives must understand that it's important to recognize the information that was collected and analyze it in a way that they can prove to employees that they've understood and understand what feedback they have, and that they can make a plan based off that information to benefit everyone from that. Collecting the employee feedback can raise many issues within the company. Employees may have certain things that they want leaders to do that they can't necessarily provide or make a reality for the employee. And then, for instance, employees, they feel like they need more of a work-life balance, and leaders of the organization aren't seeing that enough because they won't provide additional downtime for the company, which creates chaos in the workplace because employees are not agreeing with leaders and they can't come to a medium, a middle on that, on a compromise. It is important that these leaders in the healthcare industry analyze this information and decide which information is worth tending to. Any issues that are small or minuscule, they should be held off on, not put at the forefront of concern because it's not a common issue that everyone is speaking on. Leaders must be able to identify those issues that are worthwhile and deserve attention for the benefit of the company and the success in the future, so that they can develop a plan based off that feedback and significantly impact the culture of the company. When it comes to analyzing and collecting employee feedback, here's a graph showing the employee engagement effect on key performance. And from the graph, leaders can tell just from looking at the data collected that they should want employees to come to work more often. They should push for a reduced turnover. They should push for having less things stolen from the business. They should push for more improved quality of service and a reduction in safety issues. The graph shows that there's both a problem and also good reason to put a plan into action on specific issues such as the ones mentioned above. And most importantly, leaders must analyze and understand how they can improve employee engagement for the success of the business in the future. And that's what it's all about, taking that feedback and providing a solid plan that'll help benefit and improve issues that are occurring within the company currently. One of the most important factors when it comes to employee satisfaction is providing a fun and enjoyable work environment for the employee. Providing a fun environment will allow the culture in the workplace to be enhanced. Employee relationships will be built. They will become more genuine, and it won't come at the expense of productivity in the workplace. And some of the things that leaders can implement in the workplace that will scream fun to employees are having casual dress down Fridays, ways that employees can be comfortable while they're at work. Throwing an office party for birthdays and anniversary, just showing that you recognize the personal aspects of the employee's life, making them feel valued to the company. Having different theme contests for prizes, whether that's who can complete this or who can turn this in first. Very competitive atmosphere that'll help employees, get engaged and have fun and want to stay with the company. Organizing a potluck meal. That's more of a bonding event for employees where they can come together, speak, get to know each other on a deeper level sense. And hosting community service events with the surrounding areas, not only will that benefit employees, that will also benefit those around you, and you'll have the support of those communities around you as well when it comes to patients coming into the organization, and them as well spreading good news about the company and how they're progressing and becoming more successful. And lastly, organizing a fun committee to innovate new ideas for both in and out of the workplace. This committee will be over
making sure the workplace is enjoyable overall, making sure there's always something planned, something upcoming, something to look forward for employees. And if employees have something to celebrate and their contributions to the organization are recognized, then they will feel more value and they will be satisfied.
I'd like to start with talking about patient care and safety. How well do you know the patient? Concerns about the patient and offering respectful and flexible environment. What I mean by that is basically you want to make the environment as flexible and as comforting as possible. The patient is already somewhat having anxiety issues based on what they got going, depending on the seriousness of the situation. And we want to be in a position to show empathy as well as understanding. Now we want to talk about patient understanding. Explanation to the patient on the patient's problem, or I would say the diagnosis of the situation. Understands the patient's medications that they will receive after the procedure and or surgery and or examination, able to follow instructions given, and understand the language. If we're not able to understand the language, how can we expect the patient to understand it? So that is very, very important to go in the process of understanding what's going on with the patient. I would now like to talk about patient involvement. Patient involvement includes involving the patient in the decision-making process, and you have to have proper response times to patient concerns. To go into patient involvement, you have to in order to involve a patient in the decision-making process, you also have to have trust. And then with response time, you have to have the proper response time according to the patient's concerns. The longer we wait to respond to their concerns, the more possibility that we may have anxiety issues with the patient. Hospital teamwork. When I say teamwork, that means that from the check-in person to registration to the actual technologist that is performing the procedure and or surgery, we should all be on one unit and one sound. And that is for everyone to be friendly-like towards the patient, and we should also practice and show empathy. It doesn't matter to me if it's the housekeeping or gift shop lady or actually the patient of the person that's responsible for insurance and or pre-certification. We all should be able to show friendly-like moods, and we should also provide a friendly-like atmosphere, because the more comfortable the atmosphere would be, the more comfortable the patient would be. and most importantly, the efficient process. How efficient the process would be from admitting to the discharge. And also, most importantly, I would say, fulfilling all the patient's needs. Again, to sum everything up, from the time that the patient enters into the medical facility until the patient walks out, that the patient experience should be as flawless, seamless, and as friendly as possible. Because the simple fact is, if the patient experience is not as well as it should be, more than likely we will not be able to perform the necessary things that needs for that patient to be better physically.